So, hello, welcome back to Dr. Chander's Dental Studio. We are back again with a challenge of 365 days, 365 new videos. So, today we're gonna talk about the topic of avulsion due to trauma in children. Well, first of all, what is avulsion? It is basically when the tooth comes out of the socket as a consequence of the trauma is what you call it as avulsion. That is, when the tooth has, due to certain kind of a trauma, the whole of the tooth has come out of the socket, and let's say in your hands or in the external environment, that is, it has been displaced or it has been totally knocked out from the oral socket is what you actually call it as avulsion. We all know that this is the age where the children, they have the tendency to fall due to one or the other reasons, because they are involved in certain sorts of sports activities. So they have a higher tendency to get trauma, because of which the avulsion usually occurs. So what to do in such a case? Well, whenever you see such a situation, always remember to find the tooth at the site of this injury. Why I'm saying this is because of the fact that you can, if you have this tooth, then you can actually reimplant this tooth back into the socket. And one more important thing, that the primary teeth, means doodh ke dant, they cannot be reimplanted into the child's socket, whereas the permanent teeth that are throughout the lifetime of the that remains throughout the lifetime in your child's mouth can only be reimplanted back into the socket. The second most important thing is that, so always remember, once you have found the tooth, remember not to pick it up from its root portion. Always try to pick the tooth from its crown portion. Why? Because it has certain amount of pedial fibers which can actually save the tooth afterwards once it has got reimplanted. Now, once you have found this tooth, always remember, you as caretakers, you are the best doctors for your child. So remember, once you have found the tooth, take that tooth just under running tap water, remove all the debris or all the dirt which is present on that tooth, and try to take and pick up that tooth from its crown portion and reinsert it or reimplant it back into the socket there and then. Only if you are within half an hour from when this injury has occurred. But if you are unable to do so, well, it's okay. You can bring the tooth as well as your child to the dentist so that the needful can be done. Now, the most important thing is how to actually bring this tooth to the dentist. Well, don't bring it in any sort of handkerchief or any tissue or in jeans pocket or any sort of thing that can hamper the pedial fibers of the root. Remember, a solution is required to transport this tooth to the dentist. For example, like the most important solution that should be, that you should know, they are, first is the HBSS solution, which is called as the Hans Balance Salt solution. Well, this is readily available in the market and it should be a part of the emergency kit also. If not this, then 1 cup of cold milk would serve the purpose, or the milk that we actually drink at a normal temperature would also serve the purpose. Third most important, if you don't even find milk at that particular situation, you can just spit some of this, you can just collect some of your saliva, the patient's saliva, into a beaker or into any sort of a beaker or certain kind of a thing, and you can store that tooth and bring it to the dentist within 1 hour from when the trauma actually occurred. Well, for best prognosis, it is very good if you bring the tooth within 1 hour from the injury, from the time the injury has occurred. And even if you're not able to bring so, even after 24 hours, if the time has been delayed to 24 hours also, still you can bring this tooth, because this tooth can be, if not reimplanted, it can be used in the form of space maintainers. So yes, you should bring this tooth along with your child within 1 hour for best prognosis. So now I'll be sharing one case report which I happen to take it from the European Dental Journal. So I'll be discussing with one case report which I have referred it from the European Dental Journal, which was published in 2013. So this is a case of reimplantation, that is reimplantation of the avulsed tooth back into the socket. So this is a patient who was 13-year-old child who got trauma due to fall, and because of which his interior, that is front tooth, it got avulsed out. Here we can see this is the where the tooth has been avulsed out and only socket is there, the bleeding socket is present. And in this case we have hold the tooth from its crown portion, and we are trying, this is a case where the dentist is actually trying but not the patient parents, because they are not aware of it. So yes, the dentist is holding it from the crown portion and put it or reimplanting it back into the socket. So here we can see we have given sutures over here and all. So the tooth is already reimplanted now, and this is the palatal aspect where we can appreciate, yes, the tooth has gone back into its socket. This is the post-operative. We can appreciate it after 2 to 3 weeks when the healing has actually occurred, and the tooth is looking very well over here. So yes, it is possible to re-implant the tooth if it is brought within well particular framework of time. So signing off for today. Stay home, be safe, and see you soon. Goodbye.